This is Dr. Max at Hair by Dr. Max Restoration Center. Happy Labor's Day weekend, everyone. Today is Monday, and what I do on the Labor's Day, I'm actually at work. The reason is because right before the weekend, I had a patient who underwent a big mega case, close to 4,000 graft surgery, where we remove 4,000 hair follicles from the occipital area and the temporal area to the front. These cases usually take a long time. It's very laborious process. I use a special microscope to extract these hair follicles one by one. Then I place them one by one back into the scalp area, making sure that the hairline is completely natural and looks perfectly normal later on. So it's a process. It has a lot of preparation, and every single step of the procedure needs to be performed meticulously. But with these longer procedures, there is higher risks associated too, because the grafts are outside the body for much longer period of time, and they exposed to anoxic environment. What means anoxic? There is not much oxygen flowing because the blood flow is disrupted. Those grafts taken one by one, placed on a petri dish, and here the fact that we do have a hospital grade hyperbaric chamber right in our clinic, that would all make sense, because patient having these treatments on the day of the surgery, but also important to have these treatments during the week after the surgery. Because why it is important? Because the neovascularization, or the process where the new capillaries are being created by angiogenesis to restore the blood flow, takes about 1 week. And most of the PubMed articles, and this is the evidence-based medicine that we practice, they show that HBOT, or hyperbaric oxygen therapy, helps to facilitate the process of neovascularization. By the way, after each hyperbaric treatment, most of the people feel amazing, because they have so much oxygen circulating, actually dissolved in their body, that it helps with the brain function. You feel more energetic. It helps with the repair mechanism pretty much over the entire bodily systems, right? My first commandment as a physician is to serve my patients. So I'm here because my staff is resting. I'm running this chamber by myself, try to do best to my patients, making sure they get the best results possible.